Christina. My name is Natasha Savo. I am a social service worker, and I'm here on recommendation of Dr. Smith, your family doctor. He has reached out to me in hopes of us connecting and talking through the issues that you have. I would like to go over a few things before we get started. Is that okay with you?
Yeah.
Yeah. So I'm basically just going to explain my role as a social worker. I am here on behalf to help you go through whatever it is that you are going through, obviously.
Okay.
And I am here to, us together, we are going to talk about whatever it is you're going through.
Okay.
And to establish some goals to help us obviously overcome whatever it is that is causing you to distress or all that.
Okay.
The other thing is, everything that is said here is to be kept confidential. The only way information can be released is if you ask for your files, or if you are in harm's way of yourself or of any other, somebody under the age of 16 or elders or anyone in between, and I am required to give away my case files. That is the only way any of this information will be disclosed.
Okay.
Okay. Do you have any questions before we begin?
I've seen counselors before.
Yeah.
I had a really bad experience.
Okay.
I had case files released without my permission.
Okay.
How do I know you're not going to do that?
Well, like I have stated before, anything that is said between me and you is to be kept confidential. The only way the information can be released is if you are in harm's way of yourself, or if I am required to hand them over. Obviously, what has happened to you before is a breach of client counselor confidentiality.
Okay.
And so I can assure you that whatever is said here is to be kept just between us. I understand that, like you said, you had issues with a counselor before, and that might cause you to be distrustful, but I can assure you that everything that is said will not be released unless mandated.
Okay.
Okay. So Dr. Smith has told me that you have agoraphobia.
Yes.
May I ask, was that something that you were born with, or has developed over time, or what has happened?
There was an incident a few years back.
Okay.
And I haven't really left my house since.
Okay.
The thought of going outside, I can't do it. It scares me too much. The fear of what could be outside. I know it sounds stupid and irrational, but I can't do it.
Obviously, something very traumatic has happened to you, and for you to be terrified to go outside, it must have been something that is very obviously life-changing, but it is not something that is considered dumb. That is something that you have gone through, and something that obviously has made you so scared that you can't go outside. And it may seem, to somebody who hasn't been through what you've been through, it may seem dumb or irrational, but it's not. Obviously, you haven't exactly told me what it was. Do you mind telling me what happened?
It's not something I'm comfortable talking about.
Okay, yeah, I totally get it. As this is our first session, with what happened before, I totally understand you not wanting to tell me, and that is totally okay. So you said it happened a couple years ago?
Yeah.
Yes. So maybe you want to talk about what was your life like before this?
Not like this. I worked a regular 9-to-5 job in an office. Doing administration.
Yeah.
I drove myself to work every day. Horrible road rage. My life was completely different before this.
Yeah.
And
you have.
I fear I'll never get back to that.
Oh, okay. So another question is, how do you get all your stuff? Do you have anybody living with you, or?
My husband.
Your husband, and he's the one who gets everything you need?
Yes.
Yeah.
He does all the groceries, all the bills, anything that is outside of this house.
Mm-hmm.
He does it.
And obviously, something like this must be very. Do you have any support system besides your husband that you can go to whenever you feel?
It's typically just my husband.
Mm-hmm.
My family doesn't really come around too much.
Yeah.
And I can't go to them because I can't leave this house.
Yeah.
So it does get hard.
Mm-hmm. Have you ever tried? Do you have any siblings or close friends, or that you can maybe try to reach out to?
I have a brother.
Mm-hmm.
I could probably call.
Yeah. Because obviously, with something that makes you feel terrified to go outside, not having some people to talk to might help you be beneficial, right? Because obviously, just you and your husband, that
Yeah.
may not, it might be sufficient enough, but sometimes it's okay to talk to multiple people.
Mm-hmm.
Um, and so basically, um, I can see that you all around your house you have all your windows closed and all your blinds. Is there
Yes.
a reason that everything is closed?
I don't like being able to see outside.
Yeah.
Um, it scares me seeing people out there, being able to see what's going on.
Mhm.
Part of me is scared that the incident will happen again or something similar will happen again.
Yeah.
Or there's people watching me or
Mhm.
judging me and my life, judging, or there might be government surveillance out there. I don't know.
Mhm.
And the I don't know scares me.
Mhm.
Um,
So from what it sounds like is whatever has happened to you in the past has really affected the way that you live and the way that your mindset is and the way that everything has shifted.
mm-hmm.
Are you taking any medications?
I believe Dr. Smith just has me on something for the agoraphobia, for the fear.
Mhm. Have you by any chance been taking any maybe anti-anxiety medications or
Um,
something like that?
I'm not sure if the agoraphobia doubles as anti-anxiety,
Mhm.
but if not, then no.
Okay. Would that be something you're interested in? Taking it could help you relax your nerves,
Yeah, I would be open to trying it.
Hmm. And obviously, with something like this, you used to have, like you said, you used to have a 9 to 5 job, you used to get yourself around. Is being able to go outside again something that you do want to accomplish?
Yes.
Yeah.
I would like to get my life back to normal, to be able to move past this.
Hmm. Yeah, yeah, and that is sounds like something that you want to get into.
Mm-hmm.
So maybe what we can do, we can start off. I can contact Dr. Smith and see what kind of medications you are on. If you're on some anti-anxiety medications, if you're not, to get you on one of those.
Okay.
Another thing is, obviously, with something like this, you might need to take baby steps, right?
Okay.
So maybe we can start off by opening a couple blinds up. It doesn't have to be anything too big. It doesn't have to be multiple in a room. Just maybe a few of them. And with something like that, and with something with a fear that you have, maybe being on these, maybe getting on this anti-anxiety medication will help you through the process.
Okay.
Is that something you're willing to do?
Yes.
Yes. Okay. So yeah. What we can do is I can schedule when I go back to my office, schedule an appointment.
Okay.
And maybe we can meet up again 2 weeks from today.
Okay.
Okay. And another thing is I can also send you an email.
Okay.
Confirming the date and the time. Obviously, we're going to have it again at your house. And so that is something that you're looking into?
Yes.
Yeah?
I would be open to that, yes.
Okay. Alright. Well, so then that concludes our session. I will see you again in 2 weeks' time.
Yes.
Okay.